Another one to the thumb. And the grip I have on the back side, I'm gripping his thumb pad. I'm just pulling. I'm gonna go ahead and get my body positioned to where I have some support. And this guy, I'm guessing, is 4?
1.
1?
Yeah.
Hey there, 1. You're perfect.
If you ever use just push buttons.
Yeah. Oh yeah, 1. Gotcha.
You'll eventually find the one that's working.
Yeah.
Oh, it feels good. See, and that's the thing. I can work on it myself, but it doesn't feel the same as having somebody else do it.
Never does.
Yeah.
I'm just going to kind of press around his finger as I pull an eyelash out of my eyeball. Because that's what's happening right now. These big old things. I don't know where it is. Do you see it in there?
No.
Oh.
My up close vision isn't so hot. I need reading glasses.
Oh, we're good. It moved itself out. So I'm just pressing around his thumb, finding the tension.
Oh, yeah. Oh, man.
A little tender in there.
It like lights up down my thumb.
Oh, yeah.
You're in that. Can you feel like
oh, yeah, I feel it
difference?
right in there.
Yeah. Oh. And again, I don't know what it did to it. It just started acting up.
And I kind of, you see, I just kind of, it's like almost a handshake. I'm just getting his fingers out of my way. Just so he feels comfortable. I'm not squishing his fingertips. And I'm able to come into the thumb as I press. Just kind of move the tissue around. So I'm going to come in with an elbow here, this meaty part of his thumb. And does this feel fine on your wrist?
Totally fine.
Cool. All right. Do you like it more towards the finger or more towards the middle of the hand?
I think for you, if you can go a little bit that way. There you go. Ooh, it started to light up.
So I'm going to move my hand so you can see where my thumb is at. Or where my elbow is at in his thumb. I'm going to do some movements. I'm going to flip to anatomy really quick so you can check out and see what it is that we are working on. There's your hand. So do be very careful as we're working. Some like micro movement. Feeling okay?
Mm-hmm. Very firm.
I can see the thumb is getting kind of pasty. More pasty than normal.
I'm not getting a lot of tan during COVID.
Robert hangs out inside a lot.
What do you mean Robert hides during COVID?
That's what he does. So I'm going to do another pass in here.
Yeah.
I think a little bit more into this area. I feel like it should start a little higher. And then kind of, so what I'm doing is I'm kind of sinking into this chunky part of his thumb, and then I'm shearing this way. It wouldn't be a tie jam with Kristen without some sound effects. So you're welcome. And again, I'm going to do some movements for the thumb. Does it feel like I'm still in a good spot?
Yeah.
I'm going to slowly come out. Let's see. going to switch direction, just see if that gives a different feel. Maybe I address kind of from a different direction. Let's see. There we go. So I'm going to come back in. Probably is this guy. No. There we are. Does that feel like I'm in a different area? Does it feel like the same sort of compression?
The other one felt like it was more, and I'm going to use this term just to be clear. The other one felt like it was more proximal, meaning like in towards the center.
Mm-hmm.
This one feels a little bit more distal.
Okay.
In other words, like you're covering two good spots. It just feels like this one's out towards my fingertips a bit more. It's a bit more distal.
You can't really see it, but I am moving that thumb with my finger. Just as I come in slow, I leave and pull out a little slower as well. There's the eyelash that was in my eye. Get it out of here. Lash extensions are fun until they come out. So I'm gonna do a little pulling here. And the way I'm doing this underneath his hand is my fingers are pulling from the bottom as the fingers on the top are just dragging through. So on this arm are your extensors or your flexors, which are
more problematic.
Yeah.
I think probably my flexors. That's my quick guess. Not that I can't work on either.
Yeah.
And she's like, "Hey, back." Get the mean thumb in there.
So he's just very tight along this side of his arm. So I don't know why I was being mean and just kind of pin and stretching this. Is that too much?
No. Intense, but good.
Your hairstylists always need this work. They need a good warming up, though. Sometimes I stack my weight. Now, Robert, I don't know why, I always come from this angle down, and you always go the opposite direction. Yeah. Does that make a big difference?
I don't think so, but go ahead and do what you think is comfortable, and I'll talk about it briefly.
Okay. Well, I bet you want to look at something other than my back, though. How about that?
The power of Hollywood.
Yeah.
So this is a weird kind of debate, because in traditional Thai massage circles, sometimes they want to bring stuff up from the feet and out the extremities and up out the top of the head.
Mm-hmm.
So it's almost like you're draining the arms. I do the forearm, especially the extensors right here, in reverse, because the muscle becomes bigger and larger, and the angle is me slightly going uphill because the elbow is bigger than at the wrist.
Did you say your flexors are more sore than your extensors?
Yes.
I'll flip you over.
But I worked on your extensors. So it's like, no, both areas.
It was like tunnel vision. I'm like, yeah, that's what you want? Yeah. Okay, I'm going to work this.
Both areas need work. We can only do hands and arms at Thai Massage Jam about 1,000 times before we cover it. So in functional practice, I don't see any difference in going one direction or the other. And the more I looked at pain science, it was, well, how does the client feel? And they're like, oh, right there. The more I followed that, doing what was extremely effective for the client and easier on my body, and the client went, oh, right there. I got rave reviews, but it became less and less traditional.